Whether are you taking a right kind of treatment, whether you are having a PCOD, how to self-diagnose by understanding the clinical features. The way the PCOD presents specifically is a cause of anxiety amongst young unmarried girls. There are 4-5 important features which can indicate towards that you are having a PCOS or PCOD. The PCOS is concerned with the pituitary secreting the hormones called gonadotropin hormones in excess, and that may cause high androgens. And PCOD is actually having a cyst because of immature release of the corpus luteum without any eggs. So that may also result into higher level of androgens. So both of the condition actually exhibits the same thing. Whether you are taking a right kind of treatment for PCOS, have you diagnosed it right? Because sometimes the patient easily diagnosed that they suffer from a menstrual disorder and they might be having a PCOD. So you require to understand what are the 3 threat points for PCOD. One is there may be menses which may be irregular, or they may be very heavy called menorrhagia, or there may be absence of the menses for 2 or 3 cycles, that is called amenorrhea. So oligomenorrhea, less menses, disturbed menses; amenorrhea, no menses; and heavy menses. So these are the 3 important points. Number 2 is there may be abnormality of body hair. You may be having a hair which female do not have on the abdomen, on the front part, on the back part, on the nape of neck, on the abnormal areas. And they may be having excess of oil. There may be a loss of hair in the typical pattern. They get a thinning, and they might be having a start of thinning immediately after their menses becomes disturbed. Maybe a acne, eruptions on the face, maybe big pustules on the face. There may be a problem with pregnancy, fertility. So these are the very important part. Apart from this, the obesity or weight gain tendency must be there. If we check the insulin levels are high because of the insulin resistance. There may be mild diabetes, so HbA1c and fasting glucose required to be checked. Glucose intolerance should be checked. So they may be having a personality of anxiety and lots of stress, exam stress, the family stress. They might be forbearing some kind of fears, so that stress may result into PCOD conversion in a young female. And mostly the female who have menarche, the start of menses at a very young age, like 7, 8 or 9, physiologically they tend to have the cystic ovaries, and they may be skipping the periods. So overall, you require to understand there may be a weight increase tendency, menses, there may be skin eruptions, there may be the abnormal big hair, there may be the tendency to keep the fat, that is concentrated fetal obesity. They may be having insomnia, stress, panic disorders, anxieties, mild depressions. All these things may also indicate that you are having a PCOD, provided that if you're medically checked, you may be having a high LH and FSH ratio changes. You may be having a DHESI or free androgen index, that is called free testosterone level may be high. And you may be having a thyroid as well in such cases, because most of the PCODs are inflammatory and they have a high insulin. Some cases may be adrenal, some cases may be after stopping their OCP. See, taking a treatment which can support and manage, as with most of the general physicians in gynecology, is a treatment of choice in medical science. But I say, are you taking the right kind of treatment? Because such treatment may have their own side effects. Such treatment may help you to have a menses, but after stopping you may be having a worsening of the condition. So friends, and oral contraceptive medicines or combination pills or progestin pills may result into actually more increase of obesity and more HPOA axis disturbances, that is called hypothalamus pituitary ovarian axis disturbances. So such condition may be harming you in long term, because it may result into more of the features. So if in case that's not helping you and doctor has spoken that you have to take it for a long time, even after weaning up the medicines, your condition again returns back, yes, please come to Dr. Satsangi's. Go ahead with the homeopathy, go with the AYUSH treatments. If it is well diagnosed, the root cause of the treatment is done, that is the stress, your personality is being taken care of it. Diet, vitamin D and different biomarkers will help you to guide with best of the exercises and lifestyle changes. And you're required to understand that there are 4 pillars with Dr. Satsangi in treating scientifically PCOS or PCOD is: number 1, consistency of your treatment. Number 2 is consistency of your exercises. Number 3 is consistency of your routine about your diet. Number 4, consistency about doing pranasana. So taking care of your stress and your personality will definitely go in the long run. So friends, don't wait. go ahead with the AYUSH treatments, go ahead at Dr. Satsangi's, because it's a participatory protocol, so you require to understand that you are at the recipient end, you have to take 40% of the in charge of the treatment. All this consistency factor which I have spoken about, exercise, pranayama and will to change, need to be there with you. If you do it, then 40% of the action of medicines and 20% of your body will results into a betterment of your case right from the root, and with the time you will recover in your wellness, personality, and PCOD goes down. So it's very important for you to approach to us at a right time. Early it is being treated, the better are the results. Friends, don't miss all these information. Watch them 2 or 3 times. If you want to write something, write it to me. Share with your friends, subscribe my channel, and speak to me about any other information which you want. I would bring in the form of tutorials. And all the best. Take care. आपके अंदर ईश्वर को मैं पुनः नमन करता हूँ. Take care of your health.